Hello, everybody, and welcome to another session hosted by the Mental Health Foundation Australia, talking today about unemployment and mental health. I want to firstly begin by acknowledging the traditional owners of the land on which we live and work, and we would like to pay our respects to their elders, past and present and emerging. On behalf of the Chairperson of the Mental Health Foundation Australia, Mr. Basan Srinivasan, our patrons and Board of Directors, I welcome you all today to our Mental Health Forum, talking about unemployment and mental health. National Mental Health Month is an initiative of the Mental Health Foundation Australia to advocate for and raise awareness of Australian mental health. It's an important time where the Australian community comes together to raise awareness for mental health matters, and that mental health matters. The National Mental Health Foundation, bear with me as my screen is switching. As part of the National Mental Health Month in October, the Foundation is organising mental health forums on important topics, and today we're here to discuss unemployment and mental health. Throughout the month of October, unlike many mental health awareness campaigns, we are arranging many discussions and events. And of course, because we are in lockdown in Victoria, these are taking place virtually. The aim is to bring us together nationally and to ensure that this conversation continues to be a focus point, given the high amount of mental stress that Australians are experiencing at this time. The global pandemic itself has brought increased layoffs and a rise in the unemployment rate, and it's been established that there is a two-way link between unemployment and mental health. We know that poor mental health leads to unemployment and vice versa, and the Mental Health Foundation Australia would like to address this gap and raise awareness about being more inclusive in the workplace through organising virtual mental health forums on this important topic. I'll talk briefly about myself. I have a legal background. I'm a senior associate at Maurice Blackburn, and I have witnessed many times the devastating impact that unexpected mental illness and then absence from work and an inability to return to the workplace has had on my clients. And I advocate on their behalf to pursue insurance benefits so that they can get much needed funds to become financially secure again, and also to be able to use that money to access mental health supports and treatment. Before I go on to introduce our esteemed guest today, I do want to invite you to view our journey through a video that we've prepared, and please enjoy this video for a few minutes prepared by the Mental Health Foundation regarding our Mental Health Month of October.
A journey of 1,000 miles begins with a single step. Mental Health Foundation Australia's journey began 90 years ago. It dawned in 1930 with just a founder and vision, which was to reach and impact Victoria. Now we have a presence in all states and changing lives for over 100,000 people throughout Australia. Our organisation's biggest initiative yet is our National Mental Health Month. Our month-long initiative is to advocate and raise awareness on Australian mental health. Our vision is to recharge and educate as many Australians as possible to help reduce stigma and facilitate positive and non-judgmental discussions surrounding the important topic of mental health in Australia. With the theme being Mental Health Matters, the awareness is cumulative. In 30 events we have organised to reach the community in all mental health subject matters affecting our lives today. To further continue our journey of 1,000 miles, the Walk for Mental Health has transitioned from a Victoria-only walk to being a nationwide community walk, where anybody from anywhere in Australia can connect with us and walk with us virtually to spread the impact and awareness of mental health. We pride ourselves with making sure all our programs are for the community and are powered by the community. We have a vast growing network of multicultural ambassadors who are part of our program to further the community voice in promoting positive mental health and well-being. Our multicultural network has inspired our educational and multicultural webinars as an initiative to help power Sodality to cope with success during the pandemic. To promote the understanding of unique cultural and ethnic heritage in Australia and the development of culturally responsible and responsive curricula. The Mental Health Foundation of Australia conducted the multicultural research to continue on the development of the fast-growing multicultural Sodality in Australia. With the effects of COVID-19 pandemic, the MHFA has successfully committed the Power Hour of services and the reach to the community. With the helpline hours extended, we are here to show Australians we can be a shoulder to lean on and can be dialed to assist in all mental health matters. Our impact flows into the COVID-19 meal delivery response with the help of the community, local business and our multicultural ambassadors. It has promoted one vision, which is to serve others before self. With over 45,000 meals delivered, we continue to work with the Department of Health, the Human Services, the Salvation Army and the Australian Multicultural Foundation to continue this success. As we continue to work to deepen understanding the importance of mental well-being and educating the community, let's work together to bring better mental health for all.
I'd now like to welcome our first speaker for today, Professor David Castle. Professor David Castle is a director at the Mental Health Foundation Australia and is also currently the chair of psychiatry at St Vincent's Health and the University of Melbourne. He has a long-standing interest in the impact of illicit substances and drug use on the brain and body, and is actively engaged in programs addressing the physical health of the mentally ill and the mental health of the physically unwell. I welcome Professor David Castle to invite all the distinguished guests today.
Thank you so much. It's a great honour to be able to talk to you today. This is a topic which is just so important. It's a topic which I've been engaged with colleagues for many years, and it came from a recognition, which is very well shared vision, I'm sure, of many of you, that without gainful employment and engagement with employment and with work or vocation or both, it's very difficult to have full engagement with society and therefore full health and mental health. And as we've heard earlier, there's a strong correlation between mental health problems and work exclusion. And this works a number of different ways. So of course, if people become mentally unwell and that is not adequately treated or addressed, one can often find oneself unable to work, and that has obvious consequences. It also works the other way around, that workplaces can be a bit uninviting, unfortunately, for people with mental health problems. So it's a really critical thing to appreciate, that solutions to this need to be both ways. Obviously, the creation of employment is critical, and that's one side of it. But the openness to engaging people with mental health problems to come into the workplace is the other side. And there are effective programs from around the world. And in fact, we've been working with a number of agencies here in Victoria and have had success on a smallish scale, getting people with severe mental illness back to work. One of the really important things, as I said, is this matching up. It's matching up of the person and their skills and also their particular potential vulnerabilities with a workplace which is receptive to them. So anything which we do around this space needs to be both ways. We know that if you have a severe mental illness, you are likely, even though societal attitudes are changing in a positive direction, we know that there's still the problem of social exclusion, the problem of stigma, the problem of not feeling a valued and integrated part of society. And that's a major challenge for us. Australia, unfortunately, has not actually done as well as we would like to have done in terms of inclusion of people with severe mental illness in the workplace. We have, I was privileged to have been involved in 2 very large-scale studies of Australians with psychotic disorders, so schizophrenia and related disorders. One was conducted in the late 90s, and the other was conducted in 2010. And unfortunately, I have to report that in both of those surveys, only a small proportion, under 20% of people with schizophrenia-related disorders were in full-time paid employment. Now, that's a very low number, and other countries actually do it better. Some countries don't do it as well, but we certainly have a lot of catch-up. And the trick will be not just getting people into employment, but actually getting them to retain employment. So it's the matching, as I said, of the job to the person, and then building the skills of the individual and building the skills of the workplace to join together in making this work for people. We know that we're facing a tough time in the world with COVID. We've already heard about this from our chairperson, and there's no doubt whatsoever that there will be an impact on jobs. There already has been an impact on jobs. Of course, opportunities come up and other sorts of jobs come up as well, and we should be as positive around this as possible. But what I think none of us would want to see would be a worsening of the potential for people with mental illness to participate in the workplace because of more work restrictions under the COVID and post-COVID environment. So we need to watch this space very carefully. And the fact that we've dedicated from the Mental Health Foundation of Australia a whole session to this important area is testament to how seriously we would take this. When I talk about employment, by the way, I would include broadly vocational things. So I've been saying a lot to patients of mine recently, even if you're out of work at the moment for various reasons, use the opportunities, and there's quite a lot of them, to upskill yourself, online courses and so forth, and some of those are free through the government. So using these to build up your curricula vitae and build up your skill set. And also in the broader term, once things get back to some sort of normality within our society in terms of freedom of movement and so forth, that getting back to things like volunteering. In fact, there's volunteering which can be done over the phone as well. I have one patient who offers English language support to migrants to Australia. So and these are very worthwhile and very valued things, which can, even though they don't pay money, can be extraordinarily valuable both for the person giving as well as for the person receiving. So I would commend this endeavour today to you all. Thank you for fantastic participation. We have nearly 100 people online, and that shows the extent of the concern around this topic. I'll hand back to our chair. Thank you so much.
Thank you, Professor David Castle. I want to now welcome our esteemed guests today and our speakers for today, and some of whom will also join us for a panel discussion. Firstly, I would like to introduce Mr. Ashok Mysore, who is the Vice President and the Regional Head of Operations for Australia and New Zealand for Infosys. Ashok Mysore has over 26 years of industry experience across telecommunications, financial services, logistics, energy, utilities and services industries. He is responsible for developing a performance-driven culture among a group of diverse and talented individuals to achieve accelerated profitable growth by delivering value while continuously improving internal efficiencies. Ashok completed his executive leadership program from the Stanford Graduate School of Management and has an MBA in strategy and leadership from the Mount Eliza Business School. Thank you, Mr. Ashok, for accepting our invitation to be here today, and I welcome you now to deliver your address.
Thanks so much, Harry. Hope I'm audible. I would like to congratulate Mental Health Foundation Australia on its glorious 90-year journey and amazing work done under Chair Vasan, Co-Chair Jim, and MHFA board. It's a privilege for me to take part in this important journey of raising awareness and trigger a nationwide conversation on reaching out and educate society on the stigma and non-judgmental discussions about the vicious correlation between unemployment and mental health. We all know that unemployment is a well-recognized risk factor for mental health problems, especially around depression and anxiety, which have a significant economic impact. The estimated cost to the global economy is about $1 trillion per year, and that is just in lost productivity. And when we actually look at that from an Australian context, despite an $18 billion investment to deal with mental health specifically, the fact is that the economic impact due to the mental ill health is about $51 billion. So there's a lot that we can actually do to improve that situation. Researchers have been looking at how unemployment affects mental health since the Great Depressions of the 1930s, if not earlier. Not surprisingly, the results of these studies showed that unemployed individuals were more likely to have depressive symptoms, more stress, and lower well-being compared to those who were employed. Sorting out the effects of unemployment on mental health is complicated by the fact that the cause and effect relationship can work in both directions. And what I mean by that is unemployment may worsen mental health, and mental health problems may make it more difficult for a person to either be at work or to actually return to work. So the burden of the disease increases with the duration of unemployment. Long-term unemployment have at least a twofold risk of mental illness, particularly depression and anxiety, as I mentioned before, compared to employed persons. Unfortunately, their mortality is 1.6 times higher. And unemployment seems to be not only an effect of illness, but also its cause. The most prevalent mental illnesses in Australia are depression, anxiety, and substance use disorders. And about 45% of the population will experience mental disorder at some time in their lifetime, with about 1 in 5 who would have actually experienced at least once in the last 12 months. Anxiety disorder is the most prevalent of that, with about 14.4%, followed by affective disorder, which is depression, which is at about 6.2%. These latter categories, which I mentioned, manifest themselves in organizations where the work environments don't actively support good mental health well-being. Work is good for mental health, there's no doubt about it, but a negative working environment can lead to physical and mental health problems. So bullying and psychological harassment, which is also commonly referred to as mobbing, are commonly reported causes of work-related stress and can have substantial adverse impact on mental health. The research shows that about 66% of people who experience mental health at work in organizations that have minimal or no mental health support systems. Good news is that a lot can be done by each citizen, by the workplace, and the governments to support our fellow citizens by focused funding, efficient services, early intervention, and removing the stigma and having an open conversation around it. I do look forward to today's addresses and discussions with distinguished speakers and fellow panelists. So thank you very much. And I hand it back to the chair.
Thank you, Mr. Ashok. And as a gesture of appreciation for your address today, an engraved pen will be posted to you. I'd now like to welcome our next esteemed guest, Mr. Paul Guerra, Chief Executive Officer, Victorian Chamber of Commerce and Industry. Mr. Guerra will provide today's keynote address. Mr. Guerra is currently the CEO for the Victorian Chamber of Commerce and Industry and is an experienced leader, having held Managing Director, CEO and Chairman level roles across Australia and Asia Pacific, spanning several key industries. Paul is involved in a number of boards, not-for-profit organisations and startups. He's also an Australia Day ambassador. Ladies and gentlemen, please welcome Mr. Paul Guerra.
Thank you very much, everybody. It's my pleasure to be here today. When I commenced the role of Chief Executive of the Victorian Chamber of Commerce and Industry at the beginning of this year, I could not have predicted what 2020 had in store for us. Truth is, none of us could. To say it was a baptism of fire would be an understatement. First, we've had the devastating bushfires and the impact they had on Victorians, their safety, livelihoods, jobs and businesses, and then along came the COVID wrecking ball. I'm sure that most of you would agree that we'll be very happy to see the back of 2020. As news of this strange new virus continued to get more serious and the likely devastating impact began to sink in, Victorians, in fact all Australians, really started to worry. Then the borders were shut and restrictions were introduced, changing the way we live and work as we knew it. For many of us, our world shrunk to the very immediate. What if I have to close? What if I can't pay the bills? Does this mean I will lose my job? How will I pay the mortgage? These were the questions everybody needed to answer as COVID and the very necessary restrictions crept into every facet of our lives. Never has Mental Health Month been so important as it is right now, as we pick up the pieces from the COVID wrecking ball and attempt to salvage what is left. This month, as we unite in our goal to raise awareness of the importance of mental health, because mental health matters. There is so much focus on the physical health impacts of COVID, the debilitating flu-like symptoms, medium and long-term impacts such as loss of sense of taste and smell, and sadly, even death. As someone who has personally battled COVID, I can tell you it is a horrible thing and you don't want to get it. And I'm still suffering from the lack of taste and smell. I hope it does come back at some point though. Victorians are feeling it. In addition to the financial stresses, we are worried about keeping our loved ones safe, particularly those who are vulnerable, managing new responsibilities such as working from home and remote learning and studying online. We are missing our family, our friends and colleagues. We're missing that human connection. We were fortunate enough to have the Federal Health Minister, Greg Hunt, join us for a Veki webinar yesterday, and he flagged that new mental health data would be released today, with troubling results for Victoria. You may have read about this in today's papers or on the news online today. In Victoria, September and October, the number of Medicare-funded mental health items increased by 31% compared to the same period last year. The use of Beyond Blue's support line was 77% higher in Victoria than the rest of the country. Victorians' use of Lifeline was 16% higher and Kids Helpline 24% higher than the rest of the country. In August, the Victorian government revealed that there had been a 33% in young people presenting to emergency departments with intentional self-harm compared with the same period last year. Also during that month, the unemployment rate was 16.2% for young people, and while for the general population, it was 7.1%, according to the Youth Affairs Council of Victoria. This is partly because young people comprise more than half of the employees in the industries which have been devastated by the pandemic, including hospitality, retail, tourism, events, and the arts. And we have all read about the Netflix and Stan binging and an increase in alcohol sales as Victorians attempt to help numb anxiety and boredom. In my role, I hear from business owners every day. They are feeling a huge and sometimes overbearing responsibility for all the livelihoods of their employees. It's as if they hold their lives in their hands, and that burden is huge. It's what causes sleepless nights, irritability, and negative thoughts. Workers feel the same for their own families. They have a responsibility to provide, to put a roof over their loved ones' heads, put food on the table, pay the school fees. The anxiety, fear of not being able to do that is crippling. And it has never been more apparent and widespread than it is now, because we know that every Victorian is bearing the brunt of COVID, some more than others. Our fellow Victorians most at risk are women and children who are living in unsafe homes and victims of family and domestic violence, people struggling with financial stress and distress due to unemployment, young people especially those who are undertaking Year 12 and at university. Women who shouldered a large share of the household burden during the first lockdown and are facing it once again. Fortunately, many school kids went back to school this week. And people who are already vulnerable, living by themselves, or have been disconnected from their community and support services. The Mental Health Foundation has some really useful resources on their website, and I'd encourage you all to take a look. Even if not for yourself, you might find something on there that could help a colleague, family member, or friend. Thinking about yourself, your colleagues, or those that are closest to you, are any of them displaying the warning signs such as finding it difficult to concentrate on tasks, feeling tired and fatigued, being unusually tearful or emotional, getting angry easily or frustrated with tasks or people, drinking alcohol to cope, finding it hard to make decisions, or avoiding social situations? Well, that last one is most of us at the moment, but it's still one to look out for. Bring on Monday, when I hope restrictions in Victoria will be eased just a little bit. Federal, state and local governments have implemented a vast range of financial support for financial health, such as JobKeeper, deferral of payroll tax and grants. But we don't hear often enough about the mental health assistance on offer. The Australian Government's National Mental Health and Wellbeing Pandemic Support Plan was introduced and announced in May to meet the mental health and wellbeing needs of all Australians to reduce negative impacts of the pandemic in the short and longer term. In August, funding was allocated to establish 15 new mental health clinics across Victoria in recognition of how tough stage 4 restrictions have been, which thankfully are behind us, and has impacted the mental health and wellbeing of so many. The Victorian Government has responded well. The most recent announcement have included increasing the surge capacity of clinical and community mental health facilities, fast-tracking the delivery of acute mental health beds, and accelerating the statewide rollout of the Hospital Outreach Post-Suicidal Engagement HOPE program. The Victorian Chamber of Commerce and Industry is partnering with the Victorian Government to deliver a business mentoring program to help small businesses navigate the economic challenges posed by restrictions. Through this program, eligible business owners can receive up to 4 two-hour mentoring sessions with an experienced professional to help them make informed decisions about the future of their business. We've had over 1,400 applicants so far, which is truly an amazing response. There are a raft of other initiatives from government, but that's just a snapshot. It's a cliche, but you must look after yourself and each other. Everyone has different ways of clearing their head and taking time out. I like to go for a run in the morning, and I know others in the office use their lunch break to take the dog for a walk. Anything that helps you feel better and improves your mood is good. As Chief Executive, I take my responsibility to provide an inclusive and supportive workplace during this pandemic extremely seriously. Like all organisations, we have had to, and now I'm going to use the most overused word of 2020, pivot, our internal communications to online forums. We use a mix of Microsoft Teams, Zoom, Skype, email, phone calls, and emails to stay connected with colleagues several times a day. We are probably seeing each other more than we would in the office. There are definitely more meetings held than usual, but I can't stress the importance of remaining connected to your colleagues. And it doesn't have to be all business either. You can have some fun in your internal newsletters and meetings with things like top 5 facts that you didn't know about me articles, office trivia, virtual staff lunch, or matching the baby photo to the colleague. We all have done those at the Victorian Chamber, and it really helps to lift the spirits. And another thing to keep in mind is that a lot of people haven't had a break since COVID hit in March. Understandably, we don't want to waste our leave when we can't go anywhere to enjoy it. But the result of that is people becoming worn out, tired, and need a break. I've seen this with my own staff. Zoom fatigue, which I'm sure some of you have had, is really a thing. So I implemented a buy one and get one free annual leave day scheme, whereby staff could take any day off they choose between mid-September and mid-October, and then the Victorian Chamber would gift them additional leave day, the Monday before Melbourne Cup Day. It's been a resounding success, with a vast majority of staff taking up the offer. And now we are looking forward to that 4-day Melbourne Cup weekend where we can hopefully venture out further, hopefully into regional Victoria, and do what we have been able to do, more than what we have been able to in the past few months. For our members, we've tried to alleviate some of that financial burden by waiving membership fees for all Victorian businesses up to a value of $700. This was open to new businesses joining us as well. We also know that having the support of a workplace relations advice line, training, tools and templates, and access to Apprenticeship Support Australia has been tangible help that has gone a long way when times are tough. Our staff have been flat out, to put it mildly. But there is certainly some optimism and hope in the air. I'm excited about the easing of restrictions on Monday. I can't wait to catch up with family and friends and enjoy a meal with my loved ones at the restaurant. Just those simple things that I don't think I'll ever take for granted again. And business, those businesses that have endured will restart and revive again. We want every single one of Victoria's businesses to see a path where it'll be stronger than ever. We want them to learn how to export, upskill their team and innovate their products and services. And the Victorian Chamber wants to support them to do that. And of course, support our workforce too. I can say openly that I had no idea of this concept of mental health for much of my career. I'd come from a great family, have a great wife and 3 great kids. I'd traveled the world in a career that had been really good to me. I took a role with the United Health Group as CEO for Asia Pacific. United Health Group is the 5th largest company in the world and only focuses on health. The first part of the role was to improve our mental health division. We were delivering employment assistance programs to thousands of companies across Asia Pacific. We were by far the largest, 30-odd call takers in Melbourne and an additional 50-odd call takers scattered across Asia Pacific, answering inquiries from people to make appointments to see psychologists. With thousands of psychologists in our network, we had a psychologist no more than 100 kilometres from the person in most cases. We would save, inverted commas, at least a couple of people per week conservatively. The presenting issues weren't about work in the main. It was all about home or life stress. It was people with genuine need, needing genuine help. I felt quite embarrassed that I had not comprehended the extent of mental health battle before that role. I do now, and it's made me a better leader. It fascinates me to this day, and I've spent a lot of time working with experts on it. One of the people I respect the most in the field sums it up best. Everyone has a mental health moment at least once a day. It is a cycle of life. It's when they mount or the recovery takes longer, that's the time you need expert help. But by being aware and being supportive to someone in that mental health moment, you can play a part in assisting them to get over that moment. So when you go back to your workplace today, most likely virtually, please think about how you can do your bit for Mental Health Month by incorporating the 5 aspects to lead for better mental health for all. They are advocating for mental health, raising awareness of mental health, providing education on mental health, fostering mental health resilience, and providing mental health support to consumers, carers, professionals, and the general community. These are extraordinary times for business in Victoria. In fact, for everybody in Victoria. I can't think of a time in recent history when we have faced so much disruption to our livelihoods that's out of our control. We know business wants to bounce back, and it's up to all of us to find a path through this crisis, grow and prosper once again. Businesses need to be supported with a well-trained workforce and plan for growth. We've been the voice of business for more than 160 years and have an established and trusted seat at the table when it comes to advocating on behalf of business. Please look after yourselves and each other, and thank you for having me here today. Thanks.
Thank you so much for your address, Paul Guerra. I think I've taken a lot out of your address today, and in particular, I'm taken aback by the comments you make that that everybody has a mental health moment at least once a day, and you've given us some really good tips on how we can look out for one another and make sure that we check in and support each other. And I think that those are really good pieces of advice to give to people to make sure that we don't have people falling out of employment because of mounting mental health issues. We do want to express our appreciation to you for your keynote address today, and normally we would hand over our gift, but that will be posted to you, so thank you for today.
Pleasure, thank you.
I'd now like to welcome our next guest, Mr. Mike Hutton-Squire, who is the Executive General Manager of Health Services at Australian Unity Independent and Assisted Living. Mike Hutton-Squire joined Australian Unity in 2009 and became Executive General Manager of Health Services in 2018. Mike's prior experience has been as a senior leader in both the UK and Australia across multiple industries, including legal, finance, public relations, technology, insurance, aged care, pharmaceutical, and healthcare. In 2015, Australian Unity established its mental health service to treat anxiety and depression for people having experienced a recent hospitalisation. Now, nearly 60% of participants have recovered from their symptoms after having completed the program. Mike and his team are committed to an evidence-based intervention that are proven to work and support people leading their best lives. Ladies and gentlemen, please welcome National Mental Health Month's major sponsor, Australian Unity's Mike Hutton-Squire.
Thank you, Harry, and thank you to the previous speakers. Particularly enjoyed Paul's idea of buy one, get one free in terms of days off. And, you know, I certainly know from my own personal time through this year that having some time off from work is very fundamental to good mental health. So thank you for those comments. So good afternoon. I would like to start by acknowledging the traditional custodians of the land on which we meet today. I pay my respects to their elders past and present, and also to offer my condolences to those who have lost family since the beginning of the COVID-19 pandemic. My thoughts go out to those families. I also want to acknowledge the work that the Mental Health Foundation Australia does and their great work in mental health services. Congratulations to you on your 90th anniversary. That is a tremendous achievement, and what a commitment to mental health causes in this country. This is Australian Unity's second year of involvement with the foundation, and we look forward to tackling some of the major mental health issues and social issues together. Mental Health Month is held and celebrated in October each year, and it gives us that opportunity to raise awareness about mental health and well-being. It's also our chance to promote activities and ideas that can have a positive impact on our daily lives and the lives of others. And so today I welcome an opportunity to speak with you about the impact of unemployment and mental health, because there is substantial evidence that shows that people who have lost a job or at financial loss have a much higher risk of depression and anxiety. According to the Australian Bureau of Statistics, we're currently experiencing the highest rate of unemployment or underemployment in over 10 years. In particular, recent migrants are particularly exposed to unemployment at this time, and the evidence shows that their rates of participation in the workforce have declined 38% versus the pre-COVID levels. With an increased exposure to the gig economy, many migrants don't have the long-term job security of their non-migrant counterparts. And in Victoria, we're seeing sustained and substantial job losses due to a hard lockdown, which, whilst proving very effective for virus containment, comes with severe economic as well as personal hardship. Last week, the budget announcements once again substantially increased the investment in a broad range of mental health services. And this year, much has been said of the need for increased investment, but also of increased reform of the mental health sector. And I eagerly look forward to the release of the Productivity Commission's final report into how mental health services can be optimized, because it would seem that at the current state of spend, utilization, and unmet need, that we find ourselves in a fundamentally unsustainable situation. So whilst more money for services is commendable, it doesn't necessarily increase the supply of mental health professionals, as it takes at least 6 years to fully train a psychologist and a psychiatrist much longer. As much as we have a surge in mental health needs, we have a serious shortage of workforce to meet these needs that funding alone will not solve. There's also more work we need to do to close the gap between Indigenous and non-Indigenous Australians. and improve mental health and well-being of all Aboriginal and Torres Strait Islander Australians. Aboriginal people experience a suicide rate that is double the non-Indigenous rate. And as a nation, we need to improve our efforts to address these inequalities and not just close the gap, but exceed the gap. In terms of this year, the outbreak of COVID-19 is widely known to likely have long-term and profound impacts on Australians' mental health and well-being. As an indicator, antidepressant prescriptions have increased by 30% year on year, according to the Royal Australian College of General Practice. Despite the severe economic impact felt by the pandemic, it is perhaps the mental health impact that will be felt much greater and for much longer. So diverse community needs, Indigenous needs, and now pandemic challenges. These are the mental health issues that the Foundation and Australian Unity are facing into. For a long time, Australian Unity has recognised the importance of high-quality mental health support services. After conducting a global search in 2015, we adopted the UK's National Health Service model of low-intensity behavioural therapy called Improving Access to Psychological Therapies. We worked with Flinders University to contextualise it to Australia and adapt it for clients who have recently been discharged from hospital. The program is directly addressing the challenges with increased healthcare utilisation by enabling people to recover in their own home and stay recovered. Results from our intervention have shown encouraging results and have been published in a peer-reviewed journal as evidence that nearly 6 out of 10 participants are actually recovering from their mental health condition. The program's evidence of success is important in the Australian healthcare context to provide that linkage between primary care and acute care. And a national model of stepped care between the various settings is absolutely needed to ensure Australians don't bounce in and out of the healthcare system, but that they develop skills for self-management of their mental health that can last their lifetime. Importantly, though, improving mental health can directly reduce welfare usage and in turn increase tax collection as people return to work. This is the multiplier effect of workplace participation. So from a workforce perspective, our program can also train qualified mental health coaches in 12 weeks and have them operating at a full caseload within 6 months. And this ensures that we're able to rapidly scale the mental health workforce and ensure more people can access care, and ultimately we can help more people on the road to recovery and back to work. Australian Unity is also demonstrating its commitment to the mental health and well-being of Aboriginal Australians and communities through its recent investment into the development of a new program called Healing Minds. This program is an initiative that is jointly developed by Australian Unity's Indigenous Services Business and Remedy Healthcare Division. And it leverages our existing experience in mental health services and Aboriginal home care. The Healing Minds program commenced in July 2020, and we'll be rigorously analysing it to determine the improvements it is delivering for Indigenous people. And thereafter, we plan to adapt the program for culturally and linguistically diverse communities to respond to the growing needs for mental health support. In closing, Mental Health Month is a very important opportunity to raise the awareness about the impacts of mental ill health and the range of supports available that can improve someone's sense of well-being. I'm committed to ensuring that we develop and continue to innovate new ways for people to access and receive effective treatments that work to alleviate their mental health symptoms. This is especially true for culturally and linguistically diverse communities and Indigenous communities who we know are at higher risk for mental health concerns. We must maintain a focus on adopting services and programs that are grounded in evidence and have long-lasting, meaningful impact to people's mental health. In particular, services that have demonstrated that they can increase workforce participation should be prioritized. We commit to work with the Foundation to identify service gaps and develop culturally appropriate mental health services for these communities. This, as it has always been, is an important and exciting partnership that we can add value to what we do as individual organizations. And I thank the Foundation for their unwavering commitment to improving better mental health for all Australians. My thanks to you.
Thank you very much for your address, Mike. And it's very encouraging to hear and to receive a bit of a glimpse into the work that you're doing, particularly in tailoring the services to communities with linguistic or cultural barriers. So thank you for sharing that with us today. And we also will express our gesture of appreciation to you in an engraved pen, which will be in the post to you. I now want to move on to the last segment of our session today, which is an important panel discussion, and I'm looking forward to moderating this discussion today. I'll invite the panel members, some of whom have already provided their addresses earlier, and we've enjoyed hearing from all of them, and I'll introduce some of our panellists who we haven't yet heard from. So firstly, Ms. Lucy Brogden is the Chair of the National Mental Health Commission and the Mentally Healthy Workplace Alliance. Welcome, Lucy.
Thank you.
We've also got Ms. Alison Stubbs, who is the State Manager in Disability at Wise Employment. Welcome, Alison.
Thank you.
I also want to welcome back Mr. Paul Guerra and Mr. Ashok Mysore, whom we heard from earlier today.
Thanks very much.
Hi there.
Now, I think that it's important to note that the Productivity Commission last year estimated that mental ill health and suicide are costing Australia up to $180 billion a year, with services failing to meet community expectations. And it called for major reforms to ensure that people can get the right type of help when they need it. It is encouraging to see that the government has listened, and we have seen recently the access to psychological care doubled with the mental health care plans, people being able to access, I think, up to 20 sessions of psychological sessions, which was previously 10. And that's really in response to the psychosocial stress, which can be caused by unemployment and has a strong impact on both physical and mental health and well-being. I do want to also mention that this conversation, it's important for us to include people with lived experiences of unemployment and mental health struggles. And I do know that a lot of people on the line are engaging with this discussion because they have lived experiences as well. So what I would like to do is also commit to ensuring that our future programs include people with lived experiences as part of our panel discussions. And I ensure that in our upcoming seminars throughout the year, not just throughout Mental Health Month, we will invite people with lived experiences. So please do put your names forward if you'd like to participate in that. We might now get into some questions that people have submitted throughout and also in advance of today's session. So firstly, I wanted to put a question to you, Alison. Mental illness is both a cause and a result of unemployment. Do we have any estimates on the number of people who are unemployed due to an existing mental illness?
I can talk about our experience at Wise Employment with over 4,000 customers currently registered with us in Victoria. Approximately, 4,000 customers in Victoria. 2,000 of them indicate that their primary disability is a mental health condition. So we certainly know there's a significant number of people struggling out there with their mental health. They're certainly, some of them are working, and we're supporting them to keep their job, because I think there's an important part of what we do is not just finding people jobs, it's actually helping people keep their jobs. And we'd much rather be spending more time doing that than having to find people new jobs. So certainly we understand that there are a lot of people with existing conditions. There are a lot of people just this year who are discovering for the first time how difficult it is to adjust to changing circumstances. The word pivot, I know Paul used the word pivot. Many of our customers are sick of being asked to pivot. They feel they're over pivoting. And they were on a journey working on a pathway towards employment that has now been disrupted. And, it's not easy sometimes to pivot quickly or to respond rapidly to things, despite there being opportunities out there. So we're certainly, as a service, keen to work with people wherever they're at. and to walk alongside them in that journey, either if to find a job or to help them keep the job they've got.
Thank you. Thanks, Alison. Our next question is for Lucy. Perhaps you could provide us a bit of insight into what you consider to be the important reasons as to the maintenance of good health, or how important employment is to the maintenance of good mental health.
Thank you, and thank you, Alison, for the earlier insights and to the earlier speakers. Look, we know, and the work of the late Alison Milner really highlighted through her research the strong protective factor that work is for people. And we know that actually it's not just work, and it's important that we think about that. It's good work is good for you. And I think too often in our sector, we are asking people to compromise and take any work at the expense of actually looking for good work for people. And so I think that's an important thing to stress. But if we are looking at what are the great protective factors in our social determinants, employment sits at number one quite clearly.
Excellent, thank you. Can you also mention, Lucy, what sorts of procedures might we put in place to allow staff to perform their job successfully following the disclosure of mental ill health?
Sure. Look, it's been a very busy week in the space for mentally healthy workplaces at the moment, and it's a very exciting time in terms of creating mentally healthy workplaces. Sadly, and I think other speakers have alluded to this, Australia has one of the lowest levels of participation in employment for people with complex mental health issues. And that's really disappointing and frustrating. And I think we need to start, that's actually going to be a slightly longer journey for us to tackle those numbers, because when we step back a little bit and look at some of the barriers around employment, we're actually not very good either at having people return from disability. And so that's a challenge. And what we're unpacking to see is that there are quite low levels of mental health literacy amongst our HR practitioners in this country, amongst our recruiters. And so there's a lot of work that needs to be done to really support greater participation in the workplace. They're the problems that I've identified, but we've got solutions in the mix. And so the National Mental Health Commission, working with the Mentally Healthy Workplace Alliance, has established the National Workplace Initiative, which is really about understanding the practical skills that organisations need to not just create psychologically safe workplaces, but mentally healthy workplaces. And a mentally healthy workplace has to be respectful and diverse and create a culture where people can disclose illness or whatever it might be that is actually impeding their capacity to deliver at their best capacity.
I think that's a great point that you make, because when you talk about diversity, we do encourage people to bring their full selves to work, and yet because of the stigma that we are still trying to break down associated with mental health, it is an aspect of people's lives that they do try to separate and keep hidden. And it can be a real barrier to understanding why a person is behaving in a certain way, and be a barrier for an employer to actually support that person so that they can maintain and engage with the work that they're doing.
Absolutely. And the sad fact is that I think there are very few workplaces where I would say to someone, yes, I think you'd be safe to disclose. And I think that's a real reflection. And often if I'm speaking in organisations, I'll ask team leaders to reflect on whether in their team, someone's disclosed something they're struggling with it in their life, whether that's a mental health issue or a personal issue. But I think it's that culture of safety is tested by whether people can disclose.
Mm. I might actually segue on that point to Ashok, who as a business leader, I wonder if you often need to deal with issues of employee mental health, and are mental health concerns of your employees self-reported or maybe reported by other concerned people within your workplace?
Sure, thanks for the question. I guess the short answer to the first question is, as a business leader, do I often deal with these issues of employee mental health? Yes, yes I do. I guess as a business leader in a knowledge economy, I truly believe that a mentally healthy workforce is extremely important for us. And as a leader, I'm responsible to create an open and trusting environment, like Lucy alluded to, which actually gives comfort for the employees, where they can actually talk about either mental health or concerns or issues which they can actually raise. And it is imperative for me to be thoughtful and empathetic when dealing with these instances where the coworker is either showing signs of mental health or they actually have certain disorders which they are actually bringing to the fore. Look, employees look up to the leaders. They actually look at their behaviors. And in my position, I have the privilege and the opportunity to positively influence and create a culture of inclusivity and acceptance. I don't like the word tolerance. I think it is about acceptance, because tolerance still leaves you to say that, there are aspects which you're happy to just live with. But I think inclusivity and acceptance of that and providing support to those who are needed. And the second part of the question in terms of, do they actually come up and talk about it, or is it actually reported through managers? I think we have a mixed bag. About half of them actually do feel comfortable and safe to come and talk about their situation and their positions, either to the HR or either to their line managers. And 50%, about half of it is actually reported through coworkers, because I think, as previous speakers mentioned, I think the culture, the awareness, training of employees of early detection of these things is extremely important, and we take a lot of interest and importance on these things. So, and the interesting thing is, a number of our staff actually work with our clients on client locations, right? And they are an integral part of the team of the customer workforce. And we've had multiple instances where the client managers actually bring this to our attention, just highlighting, certain employee mental health conditions or concerns. I guess, I believe everyone as leaders, managers, co-workers, etc., has a role to play in creating a healthy workplace.
Thank you. I am mindful that we are racing to the finish line with only a few minutes left of today's session, and I do understand that people are logging in perhaps on their lunch hour, but I do want to make sure that we are responding to some of the questions and comments that people who have made time to log into this session today. So there was a comment from somebody to say that, yes, I agree, it took me many years to accept my severe and persistent mental illness, but when I did, I started to understand it more. That education for mental health should start from primary school, and they should be in class teaching students about this. And also that this is a very, very common issue. Somebody mentioned that they had the disability support officer at their former university tell them not to be forthcoming about their mental ill health, and this was while studying social work, that educational attitudes need adjusting to in addition to workplaces, and I think that that's a really important point. I think another point that's quite important too, and again, it goes to the comment I made at the start of this panel discussion, which is it's important for us to be engaging with people with lived experience of unemployment and mental health, is that if you are out of work and take any kind of work, you might end up hating it and making the mental health worse as well. So I think it's important to give some light to that experience too. And there's also somebody who has suggested we contact the Australian Unemployed Workers Union to provide people for any future engagement. So thank you for suggesting that. We will definitely do that for future panel discussions to ensure we are also putting a highlight on the lived experiences of people as well. There is a question from somebody: how can we look to positive mental health after job loss for the many who have experienced this, or indeed for those who have lost the capacity due to mental illness? Loss of meaning, identity and self-value driven by employment can have direct impacts on mental illness. So how do we do this in the context of the labour market that we're dealing with at the moment, in the wake of COVID, in the fact that we're looking to go into the worst period of unemployment and underemployment and precarious employment that we've experienced at any time in our history. How do we look to positive mental health in that context?
I'll jump in and have a go if you like.
Go for it.
I think one of the things that's really important for all of us, and I put on my sort of social psychology hat in this regard, is that it's important for all of us to not tie up ourselves in one identity, being our work identity. And that's really easy to do when we're very busy, active people, to see ourselves solely as a worker, as an employee of wherever it might be. And so I think it's really important for all of us in the good times and bad to ensure that we've got multiple identities in that regard, so that when one's struggling, we've got other places to lean on. So you mightn't be working anymore, but you're part of a netball team, you're part of a book club, you're part of the Surf Life Saving Club, you're part of the Rural Fire Service, whatever it might be. There's other parts of you that can be well supported and socially supported at that time. And I think that's a message we need to really bring down to our young people when they're starting in the workplace, is this is not all of you. There's so much more to you, and it's really important that you protect all of you and develop all of you across the lifespan, because you're not going to be in work all the time for whatever reason. Illness might take you out, economics might take you out, age might take you out, stage of life. So I think that's really important. But I do think it's really scary times, and we know that our young people are concerned about future employment and job security. And I think that's where it's really important that collectively they support each other. They become really creative about opportunities that they might have to find employment, or to keep each other engaged until times for employment improve for them.
Thank you. And I would also echo Paul's comments earlier in his keynote address too, about the resources available on the Mental Health Foundation website as well. When I joined the foundation and became an ambassador, I really got a glimpse into the amount of work that's done behind the scenes. And I think one of the gifts of COVID, if we can call it that, is that we're more connected than ever. And actually we can jump into these webinars almost completely anonymously and get support from psychologists, psychiatrists who are giving people insights into mental health issues, giving people really important strategies on how to build resilience throughout this time. So I do encourage you to share that. I certainly share it with people that I am connected to, whether it be clients or people that I know as well. So it's a wonderful and free resource, and I can only sing the praises of the foundation for the work that they're doing. I want to thank all of the panelists, and I also want to hand it back to Professor David Castle for a vote of thanks for today.
Thank you. Thanks so much. Oh, what a very rich and very, very helpful set of discussions. And, there's a danger that we look at everything through this sort of tainted COVID lens at the moment. I'm really pleased people have been picking up on being positive. I love this set of comments about not seeing everything as you being an employed person or a not employed person, that there's so many other beautiful features of all of us which we need to nurture and acknowledge. I really like the comments about good work, not just work, and I think Lucy made some points about this. The disclosure issue is one which we come up a lot, and even when I work in a mental health setting, and even within a mental health setting, people are complex about divulging mental health issues. I just had exactly this example in a staff member this week, and it's really, if we can't get it right, then goodness knows we've got a whole lot of work to do. Alison, we've so much enjoyed and found so much synergies working with WISE, and I think it's a nice example of how mental health services, university and employment agencies and people can work together and help people with cognitive dysfunction, get them work placement, support them in their work placement. And I think here I'll make a real big plug for the peer workforce, lived experience workforce. They're fantastic. They've lived it, they know it, and they know exactly what is helpful and what is not helpful in terms of supporting people in the workplace. Ashok talked about healthy workplaces and what that means, and you've got to walk the talk in terms of healthy workplaces for sure, and it makes it so much more enjoyable for everybody. And Paul, really nice overview of some of the stuff which is happening at the moment. I think we forget about how much employers struggle. You know, we talk about employees struggling, but employers who actually do, they often have these little businesses which are like a family to them, and they're desperate that they're having to let people go and so forth. And you reminded me of that being a very important group. So I finally would say this is exemplary MC we have today, and just the way you switch around and make the segues and everything. It's really
had a few IT issues, but I hope that it wasn't too obvious. So.
IT issues. And I would like to finally thank the Mental Health Foundation and all the staff for bringing this off. Thank you so much for all the participation, and the fact that we have close to 100 people online is testament to the importance of this, and it has to remain important for all of us. Thank you so much.
Thank you, David.